All right, thank you for staying with the Monday Report Town Hall session. Dr. Angela Migowa is still here with us, a pediatric rheumatologist at the Aga Khan University Hospital. Dr. Catherine Gitao, consultant psychologist at the Aga Khan University Hospital, is also still with us here. This conversation has been made possible by the European Union, the Aga Khan Foundation, and the Aga Khan Hospital. We're talking about COVID-19 and mental health. And before we took a break, there was a question back there from Edward on whether there's a structured way of dealing with these mental health issues when especially a loved one is affected, when they've lost their livelihoods, they've lost their jobs, they've lost a loved one. Is there a structured way of dealing with it?
Yeah. Okay, thank you. So I would say yes and no, in the sense that it depends on what this person is going through. He talked about the loved one going through depression. So first of all, what are their immediate concerns? I think we start from the immediate concerns of this person, so that you're not trying to comfort somebody who is hungry, you know. So first address their hunger, you know. Is it shelter they don't have? Can we first address that? So the immediate basic needs, let's make sure at least those are taken care of. Then from there, if it is a question of do they have any health condition, or are they suffering from any, even if it's a physical illness, a mental illness, then can we then now think of going to a professional? And then once they are on treatment, can we now start strategizing when they're better or able to, deal or talk about this issue? Can you now start strategizing on how can we, if it is a job, find an alternative form of income? So it's on different layers and depending on also how this person is responding to the treatment. So that you're not going ahead to first seek treatment and you've not addressed the immediate concerns, yeah? Okay. Yeah. If it is somebody maybe who you found on the verge of a suicide attempt, the first thing you want is to ensure that they're safe. That's a priority. So that you're staying with this person and watching over them, and then now seeking help in terms of where do we go next? Okay. Do we go to the immediate facility near us? Do we first look for their family to involve them in the support of this person? So it will really depend on where you find this person.
Yeah, on the magnitude.
Yes.
All right, let's come to the front row. Start with your name, sir, please, and make your comment or question.
Good evening.
Yes, good evening.
My name is Gumaywa Ferdinand. I'm an interior designer by profession, visual artist, and mental health champion with a lived experience of bipolar disorder. As an interior designer, I design spaces. As a visual artist, I mentor young and upcoming artists by providing them materials to produce artwork, a space to work from, and a platform to showcase and sell their art. As a mental health champion, I share my real-life experiences with bipolar, with real-life people, the impact they've had in my journey with bipolar, and the goodness of God in that journey. And I do this through a blog called Strokes and Prose. Strokes for brush strokes as used in painting and drawing, and prose for continuous writing and poetry. I do this by trying to strike a balance between psychology and faith without compromising what the Bible says or making light of what psychology has to offer. Before COVID, I practiced interior design in general, and as a startup, it was hard to find it. There was a very big gap between one project to another. So in between the gaps, I used to practice woodwork, and not just in small scale. It started out as a coping mechanism, which eventually, to my surprise, became now my main career. When the pandemic hit, all the projects I was pursuing were put on hold. And the first 6 months of 2020, I was generally doing woodwork. And smack in the middle of the pandemic, I actually got, while I was considering to now get training and become a certified carpenter, I actually got a job teaching woodwork. So I was facilitating woodwork and art sessions. And for someone who was perceived would not ever thrive in employment, that's why I was running my own business. I actually thrived during the pandemic career-wise, mentally and spiritually. I worked under an establishment called the DIY Studio, where we we gave space to DIY enthusiasts, and my main role was to facilitate woodwork and art sessions. And what I noticed during the pandemic, a lot of people used to come particularly to the studio, and we used to do woodwork. And they say nothing beats a lived experience, and everyone has their own lived experience. So my main role, I used to organize workshops where I'll facilitate a group of 10 people at the same time working on the same project, each on their individual piece, for a period of 5 hours.
Yeah.
And that was touch and go. And then I used to have individual bookings where I'll have a one-on-one session with a client, which are a bit more interactive, where I get to know the client gets to know me. And one of the most questions I used to get is, you don't look like a carpenter, you don't speak like a carpenter, but you do this so well. How did you get into carpentry generally? And that's why I will speak about my story.
Yeah.
And in just being vulnerable about my story, a lot of people opened up to me. And I realized people are going through a lot through the pandemic. And since, as someone said, people could not go clubbing, people could not go to church, to restaurants, they're doing everything online and virtually. You're meeting people online, you're working online. You're trying to get offline onto what? Kids are schooling online, they're gaming online. They're trying to get your kids offline onto what? The next thing close to sports was the arts. And I found woodwork to be very, very therapeutic, especially the bit of woodwork that involves sanding. Mm. So you'll start sanding, and people, for some reason, will just start opening up. Okay. And they'll talk to you. And I was lucky because my boss is an epidemiologist as well. Mm. So she gave me a platform to thrive. Okay. And I was so productive that they had to maximize my potential without stretching me thin. So they gave me accommodation. Yeah. And when I was negotiating my contract, I was very open about my condition. So they gave me accommodation, and when I was going through depression during that season, my hours were adjusted such that I only worked in hours that was very productive. Okay. So because I take medication every night, and the medication has a 12-hour half-life, if I'm taking the medication at 9 p.m., then I cannot be fully active until 9 a.m. And even so, the fast before noon, I'm actually not able to engage people. I'm awake, but I'm not able to engage people. So I'll be involved in writing and reading. Okay. Then from noon till 8 p.m., that's when I can operate at full capacity. And I'll have sessions during that time. Mm-hmm. And when I couldn't write, my boss also, my employer, I was open to the employer that I'm very good at this job and I'm thriving, yes. But then there are these things that I use as a coping mechanism that I'm falling back on. So she stepped in and gave me technical support in the blog by reviewing all my posts and ensuring all the posts were posted in time. Yeah. And also just the consistent questions she will ask me, what do you need? What can I do to make you...
And that helped the situation?
Yeah, and that helped me.
Okay. Yes. All right. Thank you. Please pass the microphone then. That's an interesting conversation from Ferdinand, because how employers also react to certain conditions is a game changer, because at least he had someone who knew that there's a certain period where he needs a bit of a fallback, and then now they get to work. But let's hear this first, then I'll come to you.
Hi, my name is Amanda Mutebi. I am an early childhood teacher and also a communications manager. So my experience during the COVID period was mostly discovering myself. But the one thing that kept me back was imposter syndrome. So this is the biggest setback for me. And during the COVID period, I was alone in my room and I was wondering, how can I express myself? So I started a blog, and it's basically like a place where I can express myself because I'm very artsy. So I would like maybe if our doctors can talk to us more about how to cope with imposter syndrome, especially during like the post and pre-COVID period. Thank you.
All right, interesting. I think we all have that imposter syndrome. Even me sitting right here, I'm thinking maybe I shouldn't be here. Let's hear that.
Thank you, Trevor. Yeah. Thank you, the panelists, and thanks for the timely conversation. My name is Samuel Buru. I'm a reader in the informal sector from an organization called Kenasvit, in Namis Maspa for Nairobi County. I'm a small business in Nairobi. I represent the informal sector. During the COVID, the informal sector was highly affected because from the heart to mouth. When it comes to the social distancing, remember in Kenya, we have less working sites and no, up to now, affordable credit to the SMEs. But we thank the President Ruto because of the Hustler Fund. During that period, it was so hectic to all. You tell me to keep the social distance, and the way as I'm saying, we have to come to contact with my client. So it was very, very impossible. The social distancing aspect of it, also it was impossible because of the lack of enough working sites, both in Nairobi and throughout the Kenya. I personally was affected because I was scheduled to travel to South Africa, but 2 days to travel, here we saw the breaking news from the Minister of Health that all the border points have been closed. It really affected me. What did we do as an organizational level? Yeah. We tried to form support groups to both all our members. And this was after implementing the 4 W's. This is who to tell my problem, when should I tell my problem, why should I tell my problem, and when. After implementing the 4 W's, now the other challenge was the outcomes, because most needed the higher level of the psychosocial. Yeah. Remember now this person have no less income. He or she was depending on the family. Yeah. Now the family has no income to implement whatever the outcomes that came out from these sessions. So it was very, very hectic, but we thank God we did it. On the family level, we lost 3 family members on the first wave. And remember, from the dressing mode, from the ambulances and the house that were coming to collect now the dead bodies, it was really traumatizing. What I would recommend or ask the panelists, from the organizations you come from, do you have affordable and accessible counseling sessions for the common mwananchi? Not every one of us can afford now to come to your facilities, but to the local level, especially in the informal economy sector, do you have affordable and accessible counseling sessions that you can be able to approach? We thank the World Health Organization because of the star 7119. There was an option for the counseling. Despite even after going that process, you have been referred to a certain place. Getting bus fare, that place was also an issue. Okay. I would be happy if you can respond. So.
All right. Yes, sir, go ahead.
Good evening, all.
Good evening.
I also want to relate to COVID-19 and its effects. My name is Dixon Yamu. I do business. I'm also a trainer. During the COVID period, I was able to realize that we can effectively adopt what we call active coping behavior. For example, it is during that period that I was able to shed off some weight, quite a number of kilograms. During COVID, I was able to go out, exercise, and realize that, yes, at my age, I could also learn. I could also do, some gymnastics. So I was able to shed off some weight. The other thing is I was able to adjust my daily routines, like you mentioned earlier. I was also able to, to start taking, public health precautionary measures very seriously. Because the things that we've always taken for granted, especially when it comes to our health, we were able to take them seriously. Dumping stuff. We were able to learn how to use tissues when blowing our noses. We were able to adopt quite a number of positive attributes when it came to our health. At the same time, I was also able to foster quite a number of social connections. Those people that you thought didn't matter so much in your lives, in our lives, we were able to connect with them. We were able to talk to them. And at the end of the day, we ended up becoming a big support unit. On the probably on the negative side, some of us parents were able to realize that our children are not of very good behavior, because when you sit with them and look at them, you're able to identify that there are things that they do contrary to your expectations. And it also gave us an opportunity to guide them towards the right direction. The last one being that expenditure was always more than the family income, and those are some of the things that have been triggering mental issues.
Yeah.
Thank you.
Thanks. I'll come to the back line to finish this conversation. But Dr. Gitau, there's quite a number of issues that have been raised. There's a bipolar disorder to deal with that. Imposter syndrome that has also been raised here. Employers' understanding that Ferdinand talked about. Samuel has talked about whether you have an affordable and accessible counseling sessions, especially for the informal sector. So you can handle the first two, bipolar disorder and imposter syndrome. Then Dr. W.H.O will handle the others where you can get affordable and accessible counseling sessions.
Okay.
Yeah.
I'm really pleased to hear how well our brother has been able to manage the bipolar mood disorder. And it's really remarkable that you have an employer who does not discriminate. That is one of the things that now I think Dr. W.H.O had brought about, the stigma that comes with mental illnesses. Because when you're talking about stigma, we are saying that you're devaluing, you're treating this person differently because of a certain illness. And yet, from what he has said, there's a lot that one can still give. A mental illness does not mean that you're incapacitated. It just means that once you manage it, just like any other illness, then you're as productive as, everyone else. Maybe not to your best capacity, but still as productive as anyone else would be. So it's really commendable, and I would really hope that this would be a testimony to, those employers who will discriminate based on one having a mental illness. And then the fact that he's able to work around, I know that I have this issue in the morning, and so I'll do 1, 2, 3. So it's quite about understanding yourself, understanding the illness, acceptance of the illness, and deciding that you will manage it, and therefore you'll live a more productive life. And of course, quality of life is really good.
Yeah.
So I don't know if you wanted me to talk more about bipolar mood disorder, but it is a condition where you have both depressive episodes and manic episodes. So when I say depressive episodes, it means that you experience persistent low moods, loss of interest in most activities, which again comes with a lot of negatives in terms of your feelings of worthlessness, hopelessness, loss of appetite or excessive eating, poor sleep or sleeping excessively. So with depression, there are quite a number of symptoms that happen at the same time. And due to the nature of these symptoms, then you're not as productive as you would normally be. So if it is even the social engagements, they're not good. Occupationally, you're not performing at par. But even that said, there are still people who will go to work even when they have a depressive episode, because there's that what we call the high functioning.
Yeah.
Then the other pole is the mania, or rather the other side of now the bipolar is the mania. So that in mania, you're having excessively high moods, or very happy, excited, or irritable, excessively irritable. And then high energy levels, so quite the opposite of depression. So high energy levels, taking part in so many activities, and not quite sometimes completing any.
Yeah.
Having this grandiose sense of self-esteem. And again, with it comes some other things where we say your judgment is not as good. and you engage in a lot of pleasure-seeking activities, which can cause you either to overindulge in drugs, sex, or excessive spending of money.
Yeah.
So again, a cluster of symptoms happening at the same time.
Okay.
And anything else in between. So that we are saying that it can be not a complete manic episode, it's somewhere in between.
Yeah. There was also a concern about an imposter syndrome where you feel you're not good enough.
Yeah.
Or you feel like maybe they'll discover that I'm a fraud all this time.
Yes. For the imposter syndrome, I think it affects quite a number of people. And it's one of those things you say, face it with the facts, yeah? Because then it's like a fear. You know, most of the time I think of it like an anxiety disorder in the sense that there is this fear, but what is the fact, yeah? So I fear that people will think I'm not qualified. The fact is, I have qualifications. So more of dealing with it on that level, I think would be helpful. For some people, not 100%, but it goes a long way in you reassuring yourself that, yes, I'm not actually a fraud, and 1, 2, 3 proves that I'm not, you know? Yeah.
So, for example, when she does her writing,
yes,
she might think to herself that maybe this article is not good enough.
Yeah. Then maybe having a mentor would help you, so that then you're passing the work through them so that they can sort of approve, and you also feel that, yeah, this is actually professional, or relays the message that I would want to relay out there. Yeah.
Right. There was some question, Dr. Migowa, you can come in for this. Samuel asked whether you have affordable and accessible counseling sessions or programs that are designed for the informal sector, those who can't really afford time to come and speak to a psychiatrist or a counselor. How do you deal with that?
That's a very important question. But before I even address it, just to add on to what has been discussed, and I think that's what we have to celebrate with all your audience today, that they are sharing their story. Yeah, the power of your story is important. I was at an event this weekend where the Kenya Christian Professional Association was giving an award to wananchi who have done phenomenal things, and one of the speakers said something for me that was powerful, and they said that you are normally placed in strategic positions of influence with a story behind you to help impact others for positive change. So whatever challenge you're going through, there's a reason. It gives you authenticity, okay? So like what our brother was sharing now about how he's now good in woodwork, yeah? And how he's passing that skill to other people, right? It's because he's gone through something that makes him sharpen that skill. All right, so whenever you wonder, am I good enough? Just remember your experiences, right, have put you in a strategic position to help influence others positively, all right? And there's power in giving your story, right? It changes now. It's no longer about me and my pity party, or poor me, or how good is. No, you're transforming that to help uplift other people. Regarding getting accessible care, especially for as pertains to mental health. And I think a lot has been done, but much more still needs to be done, okay? And sometimes we are very good in bashing our governments, but at least the Kenyan government has realized that mental health is important, right? And not just mental health, health in general is important. That's why this idea of universal health care has been, on the top of people's lips. Because what's the principle behind universal health care? Nobody should be impoverished in seeking care, whether it's for physical issues, mental issues, there's a whole different, a whole definition about what health is. So we have institutions supported by government. Contrary to what people think, Kenyatta National Hospital is a very good place, We have the Madara Referral Hospital, which is also a very good place. The challenge is the stigma sometimes, that you'll go there and, oh, you won't get help, which is not true. Most of us, our undergraduate training, we actually started in these hospitals, you know? So that's one. Let's also not forget that about 40% of the healthcare in this country is supported by the private health sector, which includes private institutions and others are run by mission hospitals. Even there, I know some mission hospitals actually have provision to offer some of this psychological support.
Okay.
And then the other thing is not to forget, even these private institutions, sometimes there's a perception that it is completely out of reach. There are certain institutions that are able to offer subsidies for cases that really need help and might not have the resources. But of course, proper vetting has to be done so that people don't abuse the goodwill of some of these initiatives.
Yeah.
So I'm hopeful that things are actually going to get better.
Yeah.
We have the necessary human resource skill set in this country to advise our policymakers to make the right decisions and implement them to achieve our agenda of universal healthcare.
All right. And Dixon also spoke about active coping mechanisms, which helped him shed off some weight also. And that is something you had mentioned earlier on.
Yeah.
I'm really running out of time, but it wouldn't be fair if I don't get to hear the back. So we'll give you a minute each back there, right from you, Madam. Start with your name and then give your comment or question as we wind up on this conversation. And then you can pass the microphone around. Yes.
Good. Okay, thank you. My name is Rosemary Okore, and I want to talk about what I went through during the COVID-19. I'm a kindergarten teacher or early child developer by profession. But during that time, I developed a health problem. I was having a burning around my chest here. It was actually like ulcers. I deeply believed that it was ulcers. But when I went to see a doctor, because during the COVID-19, we feared to go to the hospital because people were fearing to meet the COVID patients there. So I decided that I will not go to hospital. For almost the whole year, 2020, I was sick, but I could not go to hospital. But eventually, towards the end of that year, I managed to go to hospital, and I met a doctor, and the doctor told me, this problem is stress-related, because they could not see my problem. They could not find anything. But they kept on telling me it's stress-related. But for me, I didn't see any stress in me. So I'm wondering, can somebody be stressed and they do not know, or they do not feel that they are stressed? So that is my question to you experts.
Okay.
Thank you.
Please pass the microphone. Yes, go ahead, sir. Can you be stressed and you don't know that you're stressed? We'll come back to you. Yes, go ahead, sir.
Good evening.
Good evening.
My name is Job Obat. I'm a businessman, and I run a digital marketing agency in Nairobi. I personally had to close business, and I had to adapt to new mechanisms of getting income. Personally, I was stressed, and due to the internet, I believe I got other solutions on how to cope with COVID-19.
Okay. Pass the microphone back there, please. Yes.
Okay, good evening.
Good evening.
I'm Victor Mondi. So I'm an entrepreneur. By the time COVID was coming, nobody knew about all that, but it all came. We were never prepared for it, but it came. So there was the lockdown, the curfews, and I had to close my shop. So I was so much depressed because there's nothing as depressing as not being able to put food on table as a man. So I had to go back to Mashambani. Somehow God worked out miracles for me, and I came back up still. But my question is, how about those guys that never managed to come back?
Okay.
What can we do to them?
Okay.
Yeah.
All right. Pass the microphone back there. Yes, go ahead.
Thank you, Mr. Trevor, for this opportunity. I'm Ian Odhiambo, youth leader at NISCOF Association. I'm a CEO at Lekki Agencies and a proud father. By the time COVID-19 was claiming a stake in the Kenyan economy, I was a student by then. I was selling cloth accessories to students over there, in the University of Nairobi. Unfortunately, what I experienced was so much traumatizing, because it threw me at financial doldrums, following the fact that students were, the rumors about the COVID-19, it was deadly, people feared everything, and if you stay keen on this, it affected the supply chain, the restriction, the trade restriction. There were not even the things like importation of clothes. So what I did for a living by then was supplying clothes to the students. And unfortunately, what I realized that they even feared my staunch customers even feared my own clothes. So somehow it affected me, because no income means no food, or at best, less food, less nutrition. So, the people that are out here, I'm in the informal sector, and up there, in Finford there's a gentleman by the name Boro, is my associate in this, and unfortunately, the informal sector was adversely affected, because they have that less social protection. They are unprivileged. These guys suffered the most as compared to the blue collar job, and the white collar job. And things are not that good to us, and maybe many other more apart from me. But fortunately enough, God was on my side. If a rat is confined in one room, at least you come up with some ideas. And I embarked on mass production of face masks. And I think there came a mind that, success is a blow turned inside out. And through this, I'm back a winner, and I'm proud of that. I give thanks to the Lord.
All right.
Thank you.
Finally, yes.
Good evening, everyone. My name is Joanne, a trainer at Beauty Point College. To give my experience during COVID, it was not easy. Number one, people are losing their lives, close family members, of which it gave me a bit of stress, depression, and I didn't know how to manage this. But one thing I came to overcome is I decided I need to get out of this. And I started to do a garden kitchen, at least to keep my mind busy and also my family. So after doing that, I managed to help some of the neighbors with some greens, some tomatoes that I was doing farming. And I would really like to thank the panelists today, because I've learned how to deal with depression, how to deal with stress, and also to help many people who may be going the same condition. Thank you.
All right. Thank you. There's a burning concern right over here. That's the third row over here. Please pass the microphone to the front. Yes, or to the back, whichever one gets there first. There you go. There's a microphone in front of you, madam. Okay.
Thank you so much. Thank you so much also for this opportunity. My name is Yvonne Wanjiru Kihumba. I'm a mental health advocate with lived experience, clinically diagnosed with anxiety and depression. I am the CVO, Chief Visionary Officer of Jasiri Warriors, and a member of the Stronger Project. Now, in 2020, I had just graduated. As the year was starting, I had just started a new job in a new town. And it was very difficult for me with all the changes. But I was tired of living with anxiety and depression. And after years of medication in 2020, that is when I stopped taking medication. And It was a long journey, but a beautiful journey, because that is when teletherapy was available, like it has never been before. And I took advantage of that. I also did life coaching, and because I'm also a Christian, I had questions to ask God, but I also did life coaching with a Christian who's deep in theology and knows all those things. Now, I have a question to our psychiatrist here, and because of that whole pain, I was able to come up with Jasiri Warriors, meaning brave warriors, and we address mental health, and we are educating children on emotional intelligence, because our system has really dealt with our IQ instead of our EQ. So because honestly, I had to leave my job as an architect that year to concentrate on my mental health. So what is the Psychiatry Association doing, and can they partner with the education ministry, the educational ministry, in order to address this issue and to come up with a curriculum? Because as much as Jasiri Warriors is trying to come up with a curriculum, I feel like we need support and we need help for the future generation. We say tech is the future, but honestly, is psychology also the future? Is mental health also the future?
Okay.
Yeah, thank you.
All right. Yes, go ahead.
Good evening. My name is Felice Tanganga. Yeah, and I would like to thank Trevor and the panelists. And I would also like to thank God, because during the COVID-19, that was in 2020, I want to thank God because I was still working. At least I didn't experience that much financial strain. And I also thank God because during that time in my church, we were stream living in our church. And I had the opportunity to attend church almost every other Sabbath. Okay, I'm a Seventh-day Adventist. So at least I found myself doing something that I love, because I would go there, I would conduct songs, I would sometimes just give quotes and all that, and at least I did something that I love most. But also there's something that affected me, because we still had our kids at home, and most of them are teenagers. And at least we tried our best, we talked to them, we really tried our best to speaking to our children and guiding them the way we could. But the problem is, there's still this problem that came up. There are still some that found a way off, maybe running away from home, running away from the house, and they went, as some of them got pregnant. Like me, I have my niece who got pregnant. Right now, she's doing her KCSE. And that really affected me, or rather, it did affect us as a family, because this is a kid that we've brought up since she was small. The mom wasn't there for her. And now this happened during the COVID-19. Yeah. And now, right now, it's like everyone in the family is bitter about that kid that was born. Okay. So how do you go about that? Because the economic situation isn't favoring us. There's no milk for the baby. There's so many problems going on. So how do we deal with that?
Okay.
Yeah.
All right. Finally, yes.
My name is Tabitha Kabura Mwangi. I'm a mental health advocate. COVID for me was a blessing in disguise, because I lost my job, and also my husband lost his job. At the same time, I was also having a newborn, so I also suffered postpartum depression. Luckily for me, I have a very strong support system. That is my family and my church and some of my friends. And I say it's a blessing in disguise, because having suffered a lot of suicidal thoughts in my mind and suicidal voices in my mind, I started an initiative where me and some of my few friends who are also my support system started an organization that is called Mental Voices Africa, whereby you just meet up and create safe spaces where people come and share their stories, where people can come and be vulnerable and share their stories without fear of judgment. And it has really helped, since people are coming up and they're speaking up about their mental issues, and at least you're able to help people that are suffering mental health. And for me, it was a blessing in disguise. Yeah, thank you.
All right. Thanks. Dr. Gitau, now there's quite a number of issues that have been raised, but I'd like you to deal with two. One of them, the suicidal thoughts and teenagers and their coping mechanisms, where a child is actually born, but now a family is bitter towards that because it's a constant reminder that they feel like they failed this little child. Yeah.
Okay. All right. So let me start with the suicidal thoughts. I'm really glad that you're able to come up with something from your experience in terms of you made the negative experience something positive, and now you're supporting other people. And I think that's the essence in terms of when we face trauma or difficult situations that don't really make sense. What are the lessons we pick from there so that they can make us stronger? Because I think in life there's so many things that are unpredictable, and things can change, suddenly, just like we saw with the COVID-19. So based on what each person experienced, and I think Dr. Migoa talked about it, what can you pick from that and, make is it a flower or something good out of it? Yeah. And that is really good. So the suicidal thoughts, I think, were more prominent then because of so many things. Many people went through that. They were having suicidal thoughts, suicidal ideations, suicidal attempts, and even maybe self-harm, in the sense that you're harming your body, but not with the intent of dying. So why then is because one of the things that we say with suicide is the lack of connection, though you talked of having a good support system. But for most people, the lack of connection was one of the things that led to that. The loss of a job, feeling that now you don't have anything to offer and you don't have an income. So with the loss of job, there are many negative things that are attached to it. So the lack of now belonging, the lack of income, and then now you still have a family. As you mentioned, there was a newborn. Then what? So a sense of hopelessness. So those are contributing factors. Then in terms of those who have gone through difficulties in the past that have caused a lot of pain to them, we call it psychological pain. Then again, you're experiencing another difficult situation. Then it tends to now bring up the issue of, then is life really worth living, So then the thoughts start coming of suicide. Is it better if I was not here? So it's also, I would say, it is a way that people try to cope by thinking of suicide as a way out, but it is usually negative in the sense that, life is not the issue that you're trying to solve with suicide. You're trying to solve a problem with something so permanent. So why not address the main issue, yeah? And yeah, as you mentioned, now you're able to at least develop something from there.
Yeah.
So yeah, that maybe could have been one of the reasons that most people had those suicidal thoughts and ideation.
And how does a family deal with teenage pregnancy that then ended up being a child was born, and now everybody seems to have something against the child? How do they deal with it?
Okay. The feelings of disappointment in that you were trying to instill certain values in this child, and this child did not seem to get maybe the essence of what you're trying to instill. I believe as humans we make errors, yeah? I don't think anyone here can say they have never erred. So I think it's starting from a point of forgiveness. Because yes, we tried our best. There are those things that we wanted to see happen, but they didn't happen. So I think forgiving the girl is important so that you can start dealing with the bitterness. Okay. And then now from there, at least looking at yourselves also as a family, what did this really mean to you that has led to so much bitterness? I know there is a financial strain to it and all that, but I think if you pull together as family, each person at least contributing a bit, there'll be a way out in terms of supporting this girl. But starting from a point of we are all human, we make mistakes, forgiveness is a good place to start to deal with bitterness.
All right. Dr. Migoa, we're really running out of time here, but there was a question about partnerships to form a curriculum on mental health, and there was also another issue back there. Can you be stressed and you don't know that you're stressed? And then also somebody asked that how do you deal with those who went back home, but they never made it back, like he did, but back at the corner because he managed to come back. But how do you deal with those who never came back? Can you be stressed without knowing that you're stressed?
Yeah.
And what about curriculums?
Yeah. The question on partnerships is really important because I think as a human society, the way we move forward is through collaboration. According to the UNICEF report of October 2021 on the state of the world's children because of the pandemic, they found that 1 in every 7 children had a mental disorder. 1 in 5 children complained of depression. And that they found the global economy lost earnings to the tune of $354 billion because of the mental health issues that children are facing during the pandemic. Yet, globally, only 2% of the health budget was going to the mental health of children. And I'm sure for the adults, the figures are even more astronomical. Therefore, a multisectoral approach in dealing with mental health matters, and not just mental health, any other sphere of health you think about is really fundamental. So if we start probably at the larger level, more global level, prevention is always better than cure. So how do we go about trying to implement prevention? The first strategy is to find out who are the people who are at risk, all right? And you screen them because it's not practical. You know, in our country, like 50 million. You can imagine by the time you screen 50 million people, how much you'll have spent, right? I don't think there's any government that has enough money to screen everybody. So first you identify which is the group at risk, which are the groups at risk. Then when you've identified these groups at risk, these are the people you'll focus on for the screening. Then you want to find out what tips them over. Most diseases, and Dr. Gitao will tell you whether it's depression or anxiety, there's always a genetic risk somehow, and then something in your environment tips you over to get the disease. So it's important to find out what are the triggers, that would make somebody tip over and develop the disease, whether it is depression or other diseases. Then once we identify that, then now you target these groups and try and control or regulate or reduce the risk factors. And you've all highlighted them here. Loss of earnings. That's also, children, they observe us. So they're aware when mom and dad are struggling to pay fees. They're aware, and that also affects them. Once we have done that, the next really important step is effective communication, which is culturally and linguistically acceptable to the people, right? Therefore, it's important then to engage people in the grassroots, when you're coming up with this prevention strategy. So that's at the larger level. At the family level, Dr. Gitao has already touched on it. And we discussed it in the last time we were at Mr. Mbija's show, is that there's nobody who can say that they have never made a mistake, all right? And the natural human desire is to belong and to be loved. So even when our children make mistakes, even when family members make mistakes, we are not saying that we just keep quiet because we want to accept them and we want to love them. No, we correct them, but charitably, all right? Let them know that what was done might not have been appropriate, but you do it in a charitable manner. Show them that you care. Show them that you love them. Because the people who enroll our children in some of these negative behaviors, whether it is drugs or promiscuity, what do? They show them that they love them, they care for them, so the children feel indebted. Okay. And because they feel indebted, then when you're told go and sell this amount of cocaine, because so-and-so showed me they care, they go ahead and do it. So at the family level, it's important to show them that we care for them and we love them.
Okay.
Then at the individual level, and one of us talked about it, emotional intelligence now here is key, whereby it's okay to acknowledge what you're feeling. Yeah, don't sweep it under the carpet. That's the first step in dealing with it. And then using the support frameworks, whether it is family, a therapist, the church, you know, then we help equip them with resilient coping mechanisms to overcome these challenges.
Okay.
Yeah.
All right. We are really running out of time, so we really have to live with that. Thank you so much for making time. Dr. Angela Migowa, pediatric rheumatologist at the Aga Khan University Hospital. Dr. Catherine Gitau, consultant psychiatrist at the Aga Khan University Hospital. And special thanks to the European Union, the Aga Khan Foundation, and the Aga Khan Hospital for making this conversation possible. We deliberately switched it up so that you hear real-life conversations on how people have been affected, so that if you're out there, you know you're not alone and there are solutions out there. If you're a believer, I'm sure you remember Jeremiah 29:11. For I know the plans I have for you, declares the Lord. Plans to prosper you and not to harm you. Plans to give you hope for a better future. Right, my name is Trevor Mbija. Have a blessed night ahead and happy festivities, by the way. It's not all doom and gloom, all right? Bye for now.